Hey everyone, it's Anastasia, Anastasia's Hump Day Happenings, and this week I'm going to share with you, if you are going through menopause, 3 oral side effects to look for so you can ask your dental hygienist, your dentist, your OBGYN, and any other doctor who is on your team regarding what can you do to help you getting through this phase of life. Because I'll tell you this, 60% of women with systemic symptoms of menopause experience oral manifestation. Menopause, your hot flashes. Okay, we know that is established. Vaginal dryness, we know that is established. But what does that have to do with your oral health? I'm gonna tell you. Let's start it off with number 1, xerostomia. Xerostomia is another word for dry mouth. Now, dry mouth can be associated with from diet to prescription medications to autoimmune diseases to medications over the counter to caffeine to alcohol to smoking. We know this, yet when you have menopause, because our estrogen levels decrease, now we have to be really aware of what's going on. So dryness in your mouth can increase your risk for the following: dental caries, altered taste, bad breath, mucositis, and in fact, if you have dentures, difficulty in removing the dentures, or an allergy to the acrylic base that the dentures are made out of, or the metals that could be in a partial, if that's where you're at. This is a concern. Number 2, osteoporosis and periodontal disease. Other things that they're related to, when you're talking osteoporosis, we're talking risks for medically related osteonecrosis of the jaw, or MRONJ. And what that is it's basically placing you at a high risk for anti-resorbative medications that are taken for more than 2 years for cancer, corticosteroid use, diabetes, periodontal disease, tobacco use, or wearing dentures. Now, the other thing to know that you're at risk for is if you are smoking tobacco, smoking marijuana, vaping, or vaping marijuana. They're saying that's a risk factor for periodontal disease or osteoporosis, basically jaw related. I do know some studies have shared that marijuana can help ease some symptoms of menopause, such as hot flashes. I'm sharing, ask your doctors and move forward with the plan that's best for you, because think about CBD oil, which you're not smoking and you're not vaping, and therefore that could be beneficial to your oral health and clearly, helping you either sleep better or decrease the amount of hot flashes that you're getting. Also discuss your diet and your current state of oral health. Do you currently have bone loss from periodontal disease? These are things to ask. Finally, number 3, oral mucosal. This is a side effect of menopause. Burning mouth syndrome. Interesting fact right here, 3 years prior to any menopausal symptom or up to 12 years after. Are you kidding me? Like, seriously, are you kidding me? Like, flashes aren't enough? Hello, Mother Nature. Anyway, up to 12 years after. You are also susceptible to candidus, which is a yeast infection in your mouth, angular colitis, lichen planus, benign pemphigoid vulgaris, Sjogren's syndrome, and other ulcers. Pemphigoid, I will share with you, is very painful, and I'm going to share a website that I found. Go on to caregivers and patients, and then you can also get free webinars and phone calls to understand what exactly that is. I will have pictures up here, which I want to credit Crest, Oral-B, which is dentalcare.com, and RDH Magazine. These are where I got these photos from. I credit you and thank you for those, making them available online. You have to find a new normal, but let's find that new normal in health. I hope this at least sheds some light and empower you to ask your dental hygienist and your dentist, your OBGYN, and your team of doctors of what is in your best interest. You got a question for me? Ask it, I'll answer it on a future episode. And until next Wednesday, take what you learn and make a difference with it.